What abnormalities can urine cytology detect in bladder tests? Imagine a tiny microscope peering into your urine sample, searching for clues about your bladder health. That's what urine cytology does. It's a lab test that looks for abnormal cells shed from the lining of your urinary tract, especially the bladder. This test is mainly used to find signs of bladder cancer and other lining disorders. One of the most important things urine cytology can detect is high-grade urothelial carcinoma cells. These are the more aggressive and poorly differentiated cancer cells that tend to shed more abnormal cells into the urine. When viewed under a microscope, these cells look irregular in size, shape, and nuclear features, which helps pathologists identify malignancy. The test is quite good at catching these high-grade cancer cells, with detection rates often around 70 to 80%. This makes urine cytology a valuable tool for diagnosing and monitoring more serious bladder cancers. However, urine cytology is less sensitive for low-grade urothelial carcinoma cells. These are the less aggressive tumors that tend to look more like normal cells and shed fewer abnormal cells into the urine. Because of this, the test may only detect low-grade tumors about 10 to 30% of the time. This means that a negative urine cytology does not completely rule out the presence of a bladder tumor, especially if it is low-grade. Sometimes, urine cytology finds cells that are not clearly cancerous but have abnormal features. These are called atypical or suspicious cells. Their presence can raise concern and often lead doctors to recommend further testing, such as cystoscopy or additional urine tests, to clarify the situation. In some cases, urine cytology can detect cells from other types of cancers involving the urinary tract, like squamous cell carcinoma or adenocarcinoma, but these are less common. The test can also reveal benign changes, such as inflammation, infection, or reactive alterations caused by injury or medical procedures. These findings are not cancer but can help guide further investigation. It's important to understand that urine cytology is a non-invasive test that plays a key role in screening and monitoring people at high risk for bladder cancer or those with blood in their urine. It has high specificity, meaning that if the test is positive, it strongly suggests cancer. But its sensitivity, especially for low-grade tumors, is limited. So, a negative result doesn't completely rule out cancer. That's why urine cytology is often combined with other diagnostic tools like cystoscopy, which allows direct visualization of the bladder and molecular urine tests to improve accuracy. Interpreting urine cytology requires experienced specialists because the cellular changes can be subtle. Overall, urine cytology is most effective at detecting high-grade bladder cancers and some atypical cells that suggest malignancy. It's a helpful piece of the puzzle in bladder health assessment, but it works best when used alongside other tests and examinations. If you have concerns about bladder health or symptoms like blood in your urine, always consult a healthcare professional for personalized advice and comprehensive evaluation.